Physical pain, whether it be a strained muscle or severe headache, can be a nuisance. But when that pain becomes chronic, it could have serious repercussions on our mental well-being. And that in turn can affect our daily functioning, relationships, sleeping patterns, and more. On today's Health Matters, I'm speaking to an expert about the options available for those who suffer from chronic pain. Graham Utah is a homeopath and acupuncturist with a focus on pain management. Welcome, Graham. I think firstly start off by explaining to us what is the difference between acute pain, pain we experience daily, and chronic pain.
So acute pain, I'm going to use a simple example of the hand on a hot stove. That's acute pain. It comes on suddenly, and then usually it's self-limited. It'll go away within minutes or hours. It usually affects an organ, tissue or muscle, or possibly even a bone. Trauma usually causes acute pain. It does often respond to medication. Chronic pain, on the other hand, may last days, months, or even years, and some people live with it their whole lives. It can be debilitating, and usually, if not most times, doesn't respond very well to medication. Sometimes chronic pain comes along with already a condition or medical disease that somebody lives with, for example, arthritis. And other times it may be the main characteristic of a condition, for example, fibromyalgia.
So the patients that you see at your practice on a daily basis, what symptoms do your chronic pain patients have?
In my practice, I often see patients with chronic headaches, migraines, back pain, muscle aches and pains. It really does affect their lifestyles. It could lead to depression, anxiety, fatigue, irritability. Sleeplessness.
A lot of your patients might initially resort to buying over-the-counter medication, but this can have some bad side effects.
So with patients using these medications over long periods of time at their own sort of prescribed dosages, medicines like aspirin can lead to indigestion, gastric bleeding, increased risk for stroke and a sudden heart attack. We want to encourage these people to follow doctors' prescriptions or advice and use them at the right dosages in the right quantities.
So over-the-counter medication would then usually be used for a short period. When does it become too long?
When patients are using these pills to get through on their daily lives for more than about 10 days or a couple of weeks. They're usually prescribed for anything from 3 days to maybe 10 days. And I think that should be the guideline, the safety guideline.
Yes. Besides traditional pain medication, what other options are available for people who suffer from chronic pain?
I love the simple things because people can just use what they've got at their own hands in their houses. A hot bath, you can throw in a cup of Epsom salts. It's very relaxing, soothing for muscles and sore and painful joints. Massage, if you've got a partner in the house or somebody you can walk on your back or maybe massage a muscle, that makes a big difference. Then we've got things like acupuncture, we've got Chinese herbal medicine, homeopathic medicines, Reiki, people are using reflexology, chiropractic, things you can also find in your kitchen. Ginger, turmeric.
Yes.
These are the common anti-inflammatory and pain-relieving type of herbal medicines. And they've been used for thousands of years.
No, absolutely. So we've recently seen the legislation of cannabis use. Do you think that there's any merit to this? Do you see your patients use it?
So when grannies and grandpas come to my practice, either asking for it or telling me that they're already on it, I know that it's something that's going to grow and be used more and more frequently. It's going to be used for all sorts of conditions, and it's being frequently used for insomnia, as pain relief, as well as in conditions like multiple sclerosis.
Graham, thank you for making that so easy for us to understand.
It's a pleasure.
Nobody's life should be ruled by constant pain. Don't be afraid to seek help and to try alternative options under the watchful eye of a trusted medical professional. Wishing you a healthy, pain-free week. Goodbye.